Dr. Jessica Sparshu, and today I want to decode the 5 most common causes of low back pain for you. The first most common cause of low back pain that I see on a daily basis is actually a muscle strain. So the muscles in our back can become really tight when we do something as simple as bending over to pick up an object off the ground, or maybe twist in a really unsudden and unexpected manner. The problem with that becomes that I always say muscles are the dumb jock of the body because they really only know how to do one thing: contract. At first, that response is protective. It's a protective mechanism that our bodies have in order to protect the other structures that are in our low back. However, the problem with this becomes that our muscles don't know how to relax. Oftentimes when we have a muscle strain in our low back, we get into what we call a pain, spasm, pain cycle. This means that you perform an action and it causes pain in your body, your muscle spasms up in response to the pain, and then you're in more pain afterwards. That vicious cycle tends to continue over and over. What we have to do is go in and bust up that cycle to get rid of the pain that's associated with the muscle strain and calm the muscles down. The second most common cause of low back pain that I see is a disc herniation or a disc bulge. There is a lot of talk surrounding disc bulge, disc herniation that provokes fear in people who don't really understand it. So I want to break that down for you guys and hopefully give you a little bit less fear surrounding that word disc herniation, disc bulge. So your spine is padded with these soft discs that function as shock absorbers for the joints of your spine. And what can happen is sometimes when we maybe bend over in an unpredictable manner or put a little bit too much stress on those discs, the gelatinous material inside of the disc can kind of protrude and put a little bit of pressure on the nerves that surround our low back. The reason this becomes a problem is because the pressure on those nerves then gives us low back pain that can sometimes radiate down the leg. Oftentimes we call this sciatica, but the truth is there's more than just one type of sciatica. A disc herniation, disc bulge is just one of the root causes of sciatica symptoms that start in our low back and radiate down our legs, which is why it's really important to differentiate what the cause of your low back pain or sciatica is, because we treat a disc bulge differently than we treat some of the other causes of the sciatica symptoms. The third most common cause of low back pain that I see on a daily basis would be osteoarthritis. Sometimes in the spine, we call this spondylosis. And all that it is a degeneration of the structures of your spine over time. This degeneration is fairly normal, and sometimes it can cause pain, and in severe cases, it will cause, burns, bone spurs, or increased inflammation in the area. Just because this degeneration over time is normal as our body ages doesn't mean that the pain accompanied by it is normal or has to be something that we live with. We actually have the tools to treat that pain and get you living your best life, even if you suffer from this osteoarthritis. The fourth most common cause of low back pain that I see on a daily basis is actually caused SI joint dysfunction. So your SI joint is a joint that connects your pelvis to your lumbar spine. And sometimes we can have a dysfunction or a maltracking at this joint that can lead to low back pain and some of those sciatica symptoms. The key with this one is these type of sciatica symptoms never radiate below the knee when they're coming from the SI joint. Sometimes this joint is too stiff and sometimes this joint is too mobile, but we can nail down the root cause of that and treat it and stabilize around the joint or get it moving a little bit better to eliminate these symptoms. This is something that's super common, and I see it most commonly in my female patients. The fifth most common cause of low back pain that I see on a daily basis is actually a hip flexor dysfunction. So your hip flexor is a muscle that starts in your mid-low back and comes across your hip joint to attach. It's also sometimes referred to as your iliopsoas. And oftentimes this joint can become really, really tight, and as a result of that, really, really weak. And it can affect the mechanics of your low back and your pelvis, leading to that low back pain. I hope you've learned something today from the 5 most common causes of low back pain that I see on a daily basis. If you're suffering from one of these types of low back pain, feel free to shoot me a message and we can troubleshoot it a little bit. And if you have any questions, throw them in the comments below. Thanks so much. Have a great day.